My name is Sarah Meyer, and I am a member of the HEAL Data Stewardship Group. I want to thank you all for joining us today for this installment of our Fresh Fair webinar series titled HEAL Data in Action. Today's webinar is being recorded and will be shared with all registrants. If at any point you have a question, please feel free to type it into the Q&A box at the bottom of your screen, and we will bring it up during the Q&A answer session after the presentations. Today's webinar, we are joined by Dr. Natalia Volkovsky. Dr. Volkovsky is the Data Science Program Officer in the National Institute of Neurological Disorders and Stroke, NINDS, Division of Neuroscience within the National Institutes of Health. Her focus areas are data science, bioinformatics, computational genomics, and data sharing, which includes data access, curation, and harmonization. Before joining NINDS in 2024, Dr. Volkovsky was the Senior Director of Data and Analytics at the Simons Foundation, where she led a team of bioinformatic engineers and data analysts that supported multiple data-driven projects funded by the Simons Foundation Autism Research Initiative called SAFARI and neuroscience collaborations. Her team focused on developing computational tools that facilitate responsible data sharing and analyzing high-scale genomic, phenotypic, and demographic data generated by SAFARI cohorts. At this time, I will turn the webinar over to Dr. Volkovsky.
Thank you, Sarah. Yes, welcome to the webinar. So before I introduce today's session, I would like to make you aware of the opportunities within the HEAL Data ecosystem. The HEAL Data Ecosystem Collective Board. The Collective Board advises NIH, the HEAL stewards, and the HEAL platform team in shaping methods and norms, fostering a culture of sharing and supporting data reuse, with each meeting centered on specific topic. If you are committed to advancing the culture shift toward data sharing, interested in data management topics that benefit the HEAL initiative, NIH, and the broader biomedical research community, and comfortable engaging in group discussions with a fellow HEAL investigators, we invite you to consider serving on the collective board beginning in 2026. The commitment is modest, quarterly 1-hour meetings with about 30 minutes of preparation per session, and members typically serve for about 2 years. If interested, please reach out to HEAL stewards at rancy.org. And now next slide. So just today I'm happy to introduce the new session. The session will highlight the HEAL initiative's impact by showing how applying FAIR principles strengthen transparency, reproducibility, and collaboration. We'll share practical use cases from HEAL researchers that demonstrate how FAIR practices increase the visibility and reuse of the data assets such as data sets, protocols, and code. And then we will wrap up with time for your questions. Yes, thank you. It's my pleasure to introduce our 3 presenters today. The first speaker today is Dr. Kira Bradford. She's a scientific computing principal investigator of RTI International, working at the intersections between cloud-based cyber infrastructure development and scientific research. Dr. Bradford is a co-lead of the Data Management and Consultancy Group for NIH HEAL Data Stewardship Group. Her team's science background combined with her professional and research experiences provide a foundation for her work as a leader in multidisciplinary and multi-institutional projects that accelerate research by enabling access to computational cloud-based resources. Our second speaker today Catherine Wheeler Martin. Catherine is a senior data analyst with the Center of Opioid Epidemiology and Policy at the NYU Grossman School of Medicine. Her work in the practice of applied epidemiology and epi research methods over the past 2 decades has lent insights into the intersections of health, environment, and policy in New York and nationally. She enjoys exploring patterns in data and harnessing the right methods to answer challenging population health questions, from quantifying health impacts of air pollution, climate change, and natural disasters to improving real-time surveillance for poisoning and overdose, to evaluating safety initiatives and street design on pedestrian injury rates, to her current work identifying effective policies and supports for overdose prevention. The third speaker for today's session will be Dr. Thomas Kilduff. Dr. Kilduff received his PhD from Stanford University. He directs the Center for Neuroscience at SRI International, a nonprofit research institute in Menlo Park, California. He's a co-discoverer of a neuropeptide hypocretin, aka orexin. Dr. Kilduff's laboratory focuses on the neural security underlying sleep-wake control and the development of therapeutics for insomnia and narcolepsy. He has been elected to several leadership positions in the Sleep Research Society and has served on the executive board of the SRS and APSS. He is an AAS Fellow and SRI Fellow, a Fellow of American College of Neuropsychopharmacology, and he received the Distinguished Scientist Award from the Sleep Research Society. With this, I will turn the presentations to the Dr. Kira Bradford. Thank you. Please take it away.
Thank you so much for that introduction. Next slide, please. All right, folks, I will be going over a brief overview of what FAIR principles are and how and when to apply these FAIR principles throughout the research data lifecycle. So if it's been a minute, FAIR is an acronym that stands for Findable, Accessible, Interoperable, and Reusable. And just to provide some background context, we here at the HEAL Data Stewardship Group are very passionate to help investigators within the HEAL initiative make their data fair. And the reason for that is I think we're all well aware that this initiative has been funded since 2019, and there have been hundreds of studies funded, thousands of data assets generated. And to be perfectly honest, it would be a darn shame if all those data and data assets were to end up in someone's filing cabinet at the end of their period of performance. So to combat that, we are hoping to make data a bit more sustainable by implementing FAIR strategies and helping encouraging investigators to do so. Next slide. All right, so as promised, how and when to implement FAIR best practices. So we have divided this research lifecycle into 3 broad categories. So pre-award, I'm sorry, it's too late for many of you, upon award, and at the end of the period of performance. So I'll go through each of these individually and do a deep dive. So pre-award, I don't know how many of you had to deal with research before data management and sharing plans became required, but I'm sure if you were like me, you were slightly panicked when that became a hardcore requirement. Data management and sharing plans seemed at first glance to be somewhat opaque, and it was hard to understand what the point of this was. The data management and sharing plan ultimately was meant to help you make some early decisions to begin with data sharing in mind. It stipulates that you think about what type of data standards you're going to be applying to your data, what repository your data is going to end up in, and helps you think through best practices for cleaning and curating your data. So ultimately, the data management and sharing plan is a good thing, but we can understand that it can be challenging to complete. More on that in a moment. Other things that you can focus on pre-award to ensure fair best practices. So I mentioned something earlier about cleaning and curating data. We understand that that can actually cost money. Someone's got to sit down, work with the data, and think through, are all the metadata making sense? Are all the mathing? Is everything within the correct percentage error? And that can require some budgetary funds to support that. So it's best to think about this before going after an award so you can make the appropriate budget for that. The final component to think about for your award is determine if common data elements apply to your specific program. Common data elements are something that we have waxed poetic on in many previous webinars. So if you are curious about what I mean by that, feel free to check out the HEAL Data Stewards YouTube channel for other webinars. So those are things that you can think about pre-award. And for many of you, you're already here, which is why you're in this webinar. So upon award, you may have heard us talk quite a bit about metadata. So just to be clear, we're talking about both study level and variable level metadata. So study level refers to merely things like what's the name of your study, who are the contact PIs associated with the study, what are the broad categories that you're going to be looking into for your given research. Whereas variable level metadata really dives into, well, what kind of information are you collecting? If you are a clinical researcher, what type of demographics are you measuring? What are the names of these metadata elements you're using? For instance, everyone might be collecting height, but there are 1,000 different ways to abbreviate height and also many ways to measure height. So just having this information in a variable level metadata data dictionary or codebook is super handy for later reuse. Other things to consider upon award. So the DMSP, during the crafting of that, you should have chosen a repository, but we understand that as you progress through award, your decisions may change. Things may happen within your award that you may realize a different repository will do. So I will note the HEAL Data Stewards is very aware of the confusing variety of repositories that exist. We have curated and provided you a list with HEAL vetted or HEAL recommended repositories. So definitely check out our website if you still have questions about the best fitting repository for you. Another aspect to think about as you're going through your period of performance is data curation. So that's the cleaning, that's ensuring that the variables are looking appropriate. There aren't any weird knotted numbers or missing values where you would expect to see some. If you're measuring the weight of rabbits, for instance, you may want to double check that that rabbit actually didn't weigh 3,000 grams. Real story, actually happened. And then finally, field ontologies. So if you are unaware, ontologies are a standardized way of referring to any given element. So this is especially useful for metadata. You can take a look at disease ontologies and gene ontologies and see if there's a standardized way to refer to that given element. And when you start using these field ontologies to annotate your variable level metadata data dictionaries, it actually helps with reusability. All right. And finally, the last area of the FAIR roadmap, the end of the period of performance. So submitting your data and metadata into a repository is probably one of the biggest and most exciting, if you're a HEAL Data Steward, steps for you to hit. So once you have generated your data, it's beautiful, it's submitted, it goes into a HEAL vetted repository. You let us know and we will ensure that the platform makes sure there's a record and you are officially HEAL compliant. So anytime you are publishing a paper, you take a look at what the persistent identifier used for that data asset is based off of which repository you deposit into. And that will ensure that you can link your publications to your data assets, making your research more citable. Next slide. So I told you that there were quite a few things to do. And as a HEAL Data Steward, we came into this program knowing that this can be overwhelming, especially if you're brand new to the state of mind of begin with sharing in mind. So we have here a list of tips and tools for things to use as you progress through your data research lifecycle. I highly recommend DMP tool for data management and sharing plans. They have an ad lib style version of a template that allows you to just Do some simple Q&A, fill it out, and it will bring you a beautifully tailored template that is compliant with NIH standards. Definitely consider collecting metadata and beginning your study with data sharing in mind. That tends to set you up for success towards the end, as well as storing data into one of those HEAL compliant repositories that we stewards have vetted for you. Next slide, please. So you may be looking at me like I've got a few marbles loose, and you could make a very valid point of, that's great, Kira. I would love to share my data, but I don't want to share my data yet. I don't want to be scooped. And that is totally a prevalent problem. I don't think there's anyone who's gone through their entire research career without knowing someone or being the victim themselves of being scooped. And so a lot of these recommendations that we're making within this presentation is to help prevent that from happening. It's pretty hard to get scooped when you have clearly established you generated the data, your publications links directly to your data, it's linked to your award. Hence, you are the primary person that should get that attribution. And other things you may not be aware of, just because you have considered your data for your specific research use cases only, doesn't mean it isn't actually high value. Other researchers may be interested in that data for a variety of use cases. So going through these FAIR best practices is actually super helpful for data sustainability. And then most importantly, just to get through the last bullet point of this slide, the benefits greatly outweigh of any burden when you are thinking through data sharing. Next slide. So here's what I mean. So there is actual published literature that shows that folks who have shared their data through the mechanisms that we've mentioned prior found that there were increased citations, they were more likely to form collaborations, and they were attributed with the data or the paper that they had published. So this limits the risk of being scooped. I don't know how many of you all have had this personal experience, but I'll just share. When I was a grad student, I had to finish off a postdoc project. I cannot begin to tell you how terrifying it was to open up their lab notebook and find that many of their research notes were written in Chinese. I have to say I'm not fluent in Chinese, so that was definitely a hair-raising experience. So if you want to prevent those types of experiences from happening, following FAIR best practices is actually very beneficial to you internally within your own lab, especially as you begin handoff and training. Probably one of the most important elements, especially in this day and age, is that if you follow these best practices, you are going to increase trust in your findings, and there's going to be an increased detection of errors, which will ultimately move the field forward. And then finally, starting with data sharing in mind, doing all of the steps I've elaborated on will help you efficiently progress your science and your tools. Next slide. So if you did not absorb a single word that I said throughout the last couple of minutes, that is okay. We have lots of resources and guides. Here on the slide is a FAIR quick sheet for you to access, different things to think through when you are in different stages of the research life cycle to make your data fair and to really think about doing your research with data sharing in mind. Next slide. So here is a very early graphic that we HEAL stewards like to use. This is called the Ferris wheel. You're welcome for the pun. The main points of this slide is that FAIR principles can be implemented into your research regardless of where you are within the research data lifecycle. However, it is far easier to implement these FAIR best practices towards the beginning of your study instead of waiting until you get all the way to the end of your period of performance and then realize, oh, this repository that I was going to use, they actually had requirements for how I should have formatted my data. So we want to set you all up for success and for you all to be able to implement FAIR best practices into your data. All right, with that, next slide. I will hand it off to Katie for a HEAL world example with practical applications of FAIR best practices. Katie.
Hi, good afternoon, everyone. Go ahead, next slide. So I'm Katie Wheeler-Martin, and I'm going to present today on our opioid policy Delphi project and how we implemented fair principles in documenting our study and sharing our data. Next slide. I wanted to start by acknowledging our colleagues at the NYU Grossman School of Medicine, as well as Columbia University, Rutgers University, and the Network for Public Health Law. And this project was funded by NIH NIDA. Here's my contact information. Please feel free to reach out if you have questions afterwards. Next slide. So our study arose as states were enacting numerous laws in response to the overdose crisis. And so that presents us as epidemiologists and econometrics with the challenge of trying to disentangle the impacts of any particular policy, given the staggered adoption of different laws over time by different states, as well as the overlapping adoption of different laws within states of different types of laws, all aimed at reducing opioid overdose. And so we took on a modified Delphi expert method process with the goal of developing a taxonomy of opioid-related laws. So not just considering individual laws, but trying to encompass the totality of the opioid policy environment using the alcohol policy scale developed in 2014 as a guidepost. Next slide. In the first phase of our study, we recruited a small panel of experts in opioid policy from across academic centers throughout the US. Then we expanded to a national survey that we distributed to 150 experts, again, across the United States, with expertise in advocacy, clinical practice, criminal justice, policy research, and public health. And we asked these experts to rate 50 provisions of 8 classes of opioid-related laws, shown at the right here, on a Likert scale of very harmful to very helpful, and on a scale of no impact to very large perceived impact with respect to preventing opioid overdose. We also solicited qualitative feedback on the timing of different policies, the potential interaction, whether positive or negative between different laws, and potential domains of impact that we could classify these laws into a taxonomy and ultimately create a score for each state. And as you can see on the right-hand side, we had a strong consensus between experts on the helpfulness and impact of Good Samaritan laws and naloxone access laws. Moving down along this scale towards different opioid prescribing restriction laws. And we had more divergence in opinions as we moved into methadone access laws and drug homicide laws, with overall drug homicide laws receiving harmful ratings on our scale. Next slide, please. In the second part of the study, we then took the legal provisions that we were able to collect legal data for consistently over time from different repositories. And we grouped those into 3 domain scores. So ultimately, we had 38 provisions that we were able to get data for, and we grouped them into harm reduction, treatment coverage, and opioid prescribing restrictions. And for each state, we created a score on the basis of the average of the presence of those different provisions within those domains. And we evaluated it against opioid overdose death rates using spatiotemporal models at the county level. And we saw agreement between experts' perceptions of Good Samaritan laws and naloxone access laws, which are grouped in the harm reduction domain, and decreased risk of opioid overdose during the synthetic phase between 2013 and 2020. Next slide. And so I'll move into now how we applied FAIR principles in documenting and sharing our data. First, on the next slide, we decided to choose the NADAP repository. That's the National Addiction and HIV Data Archive Program. And so this is one of the over 20 HEAL compliant repositories that Kira mentioned. In particular, it's dedicated to sharing NIDA-funded research data, which is perfect for our study. It is hosted by the ICPSR at University of Michigan, which is reported to be the largest social science data repository globally. ICPSR provides technical assistance and quality review, so to ensure alignment with ICPSR best practices, which are also aligned with FAIR principles. And so this process can take, 6 months or more, so just to be aware of at your starting point. But it does help ensure consistency and quality and reusability. Next slide. The data that we are able to archive on NADAP includes our expert surveys. So these would be de-identified survey responses. That includes demographics about our respondents, their ratings of the different opioid laws, as well as the de-identified text of their qualitative responses. We are also in the process of uploading our policy data as we speak. That's still undergoing QC. And that would be data for the 38 policy provisions I mentioned, as well as the summary scores we created for the 7 types of laws and for the 3 conceptual domains. We also used, as I mentioned in the second phase of our study, opioid overdose data. This was limited identifier data at the record level for all US deaths that we received from NCHS. And because it includes county level information about the decedents, that is not something that we are able to reshare, but it can be obtained from NCHS with a valid data use agreement. Next slide. For Findable, so last month I typed in opioid policy Delphi into Google, and our study repository came up as the second listed website in the search results. You can also access our repository. It is cross-linked to the HEAL data ecosystem on the HEAL platform. Next slide. NADAP is free and it's publicly accessible, and all of our non-PHI data, so our survey data and our policy data that are coming soon, are free to preview, download, and use without any restrictions. Next slide. For interoperability, our data are provided in CSV format, so they can be easily uploaded into any software platform. And finally, for reusability, our documentation includes our study protocol and methods, our survey instruments, our variable code books, and the R code we use to create survey weights. And so finally, I just wanted to end with a few recommendations on the next slide. And this really echoes Dr. Bradford's comments in how do we, thinking about preparing the data in advance to aid in conforming with best practices from the get-go. So reviewing your repository guidelines on, for example, how to code missing values versus refusals versus non-applicable if you're doing a survey, how you're handling date values, ID variables, character variables, and numeric codes. And so in our case, we were using Qualtrics survey. You might also be using REDCap or something like that, but it pays to review how things are being coded both on the front end and in the back end, and adjust as much as the formatting as possible from the beginning so that everything is consistent in the data lifecycle, and you can take advantage as much as possible of all of the automatic documentation that you can draw from your survey software. And finally, I'll just conclude on the next slide with a few more thoughts. So our repository provides public access to de-identified survey data and curated policy data that we compiled from a whole suite of different peer-reviewed literature and online sources from other repositories. So it allows folks to access full text of our qualitative survey responses that we summarize more succinctly in our publications. And it can also save researchers quite a bit of time in accessing myriad opioid policy data from other sources. And finally, in choosing the NADAP repository, it helped us ensure we were compliant with FAIR principles to allow the replication of our findings and to support new research. And we'll take questions at the end. And with that, I will hand off the presentation to Dr. Thomas Kilduff. Thank you.
Well, thank you for the opportunity to present here today. I certainly learned a good bit from the first two presentations. Um, as indicated, can I have the next slide, please? So my topic is something completely different than what you just heard. I'm going to talk about sharing sleep data collected in animal studies. Next slide. Just to give you an idea of what our data looks like and how it's collected, I wanted to have this image to show you our preclinical sleep-wake recording methodology. You'll see in the upper left there a little transmitter that is typically implanted in animal's abdomen, and there are leads that are coming off that. There are two leads for each. One is going to the for measurement of the EEG, which the electrodes will be placed on the cortex. And this other lead will be a pair of leads, that is, will be implanted in the neck musculature to measure the EMG or electromyogram. And as you see in the inset, we characterize in this particular figure 4 different states of arousal: wakefulness, non-REM sleep, REM sleep. And since this particular image is related to a study on narcolepsy, the 4th state that is shown is cataplexy. And I think you see that each of these states have a different signature from an EEG point of view and EMG point of view. The housing situation is shown in the upper right. As you can see, the animals have access to a running wheel in their home cage, and the cage is sitting on a receiver board, and the data is collected from the telemeter that's implanted abdominally through the receiver board and then you know, piped to the computer. On the right-hand side, you see a chamber with 8 uh, uh, animals being recorded. And as you can see, there are video cameras recording the animals' activity. So the next slide gives you an idea of what the actual data looks like. Um, You'll see an image shortly of the EEG, the EMG activity, and then, of course, the animal in its home cage. Each vertical line there, pairs of vertical lines, represents a 10-second epoch in which we decide whether, as indicated below, whether the animal's in wake, non-REM, REM sleep, cataplexy, or in running activity. So you can see now the animal is in its wheel, and you see a epoch that has OAA, meaning O for running wheel activity. And then in this case, the animal emerges from its wheel and has an attack of cataplexy in this particular case. And cataplexy is characterized by a high hypersynchronous theta and a low EMG, hypersynchronous theta in the EEG and a low EMG level. And that's why these epochs you're seeing now are scored as C for cataplexy. And at the very top of the screen shows the animal's history over the last 12 hours. So in basic sleep studies, the duration of a particular sleep recording will vary depending on the type of study. For example, if you're characterizing the sleep-wake characteristics of a new transgenic strain or a mutant animal, you'll want to record a 24-hour period and then score this record, that 24-hour record, in 10-second epochs. If you're doing a pharmacological study testing a drug, you might only need a 3 to 6 hour recording. If you're doing an optogenetic or chemogenetic study where you're manipulating a particular cell group to determine its role in controlling sleep and wake, again, the duration of the sleep recording may vary. It might be 2 hours, might be 4 hours, depending on the duration of the manipulation. But in any case, there's this laborious step where one has to record and decide in your epochs. Some people, I've mentioned 10-second epochs. Some people record in 4-second epochs. And that process of decision making is very laborious, which leads to why we want to share data in the next slide. These are just some of the dependent variables that come from EEG and EMG recording. Sleep architecture measures the percent time awake, REM sleep, etc. EEG power spectra, that is the intensity of the electrophysiological power during any particular state. and then some general physiological measures, locomotor activity and core body temperature. These are basis for analysis. Next slide, please. So why to share these EMG recordings, EEG and EMG recordings? Well, of course, there's the NIH mandate, and of course, journals these days require sharing of data. At a higher level, of course, the data that's collected, at least that from with NIH support, is taxpayer funded. So it should be in the public domain. But the main benefit really is the reason is the benefit to the scientific community. As I mentioned, one of the rate-limiting steps in the sleep field is this laborious scoring of the EEG records. And there's been a big effort over the last 5 years in particular in accelerating for coming up with better and better ways to come up with automatically scoring sleep-wake. One of the limitations for computational people in testing the algorithms that they have developed for scoring sleep-wake is the paucity of data sets that are available in the general community. So that's the major reason why we decided to share our data sets. And that is, once they're posted, as suggested earlier, that leads to novel analyses by other individuals, and that could lead to unexpected collaborations. And I mentioned that later on one collaboration that resulted from this. Next slide, please. So then the question that is raised earlier is where to deposit your data. And there's a relatively limited number of data, neuroscience-oriented databases, some of which are limited, are listed here. And then there's a number of HEAL recommended repositories. I didn't realize the number was up to 36 now, but of course only a subset of those are appropriate for neuroscience. Well, we just, looking around at various alternatives, we decided instead to use something called the National Sleep Research Resource. Next slide, please. This resource was published, this paper describes the NSRR, it was published in 2018. The PI of the NSRR is Professor Susan Redline, who's at Brigham Women's Hospital and Harvard Medical School. Next slide. So this is the home page, a landing page of the NSRR. And as you get a sense, there's a community that has evolved from people who are depositing data through at this resource. I should point out most of the data sets that are on there at the moment are human data sets. Our lab was the first to deposit any animal-based data, but I'm pleased to say that there are other labs now that are following up on that. Next slide. So why the NSRR in particular? As I indicated previously, Susan Redline is the PI on a NIH LBI funded repository that was founded originally in 2014. And I was attracted to it because of all the human data that ended up being deposited there, and the effort that had gone on to result in data harmonization and creation of tools for analysis or open source, some of which are applicable to animal-based data as well. And I became aware of the NSRR actually through some webinars and other community events that are held at scientific meetings such as the sleep meetings. Next slide. So NSRR conforms to FAIR principles. I think Catherine has done a great job in explaining what these are, so I won't repeat some of her same points apply here. Next slide. So I just want to point out, to this point, we have deposited 4 data sets. The 2 that are shown with the arrow or from HEAL funded studies. One was published in PNAS, another in the Journal of Sleep Research. We have a 5th data set that is supposed to go live either today or tomorrow. And that relates to the last topic area, trace amino associated receptor 1. Next slide. So this is the instruction page that should one decide to share their data on the NSRR And some of the points that have been made earlier in this webinar are kind of recapped here. What you'll do, you'll identify, create initially an intake sheet, a survey that leads to capturing the data, the metadata that will be associated with your deposit, and ultimately culmination after going back and forth and data curation, you'll upload your data to the NSRR through a specific site. Next slide. This just indicates, I know it's low resolution, but what the page looks like for one of the HEAL related studies that we conducted in, as indicated here, a C57 black 6 mouse, a morphine withdrawal study. So the major sections are indicated on this page. One is a brief about what the study is about, a link to what the methods are, so which could be in supplementary material, a data overview with the type of data. We typically upload what are called EDF files and FFT files, and any data access restrictions and usage restrictions, as well as a citation for reuse of the data. The next slide shows one last study that was also HEAL funded. This was the one that was published in PNAS. And just indicate that you'll note in the middle there is a request data access. So if you want to restrict data access for and reuse for basic science studies as opposed to commercial studies, you're able to restrict the data access. And anyone who requests access to your data will need to be approved by the depositor or the PI. Lastly, I just want to acknowledge the people who contributed to various studies that I've mentioned here, and pleased to turn this now over to Sarah Meyer for a wrap-up.
Thank you to all of our presenters, and now we are going to move on to our Q&A session. And so if all of our Q&A team members could turn on their cameras, we're going to stop screen sharing and begin with questions. All right. So our first question, I believe we'll start with Dr. Bradford. Can you tell me a bit more about the tool for the DMS? Is it AI driven, and how does the tool work?
Sure, happy to speak to this. So DMP tool is a completely free online open source tool. It's not in and of itself AI based. What it is it provides you NIH compliant templates for you to fill out, and it gives you some examples of what other people have put in, and can also help give you some prompts, so that way you're not coming up with something on the fly that isn't quite compliant with it. I will say one of the efforts that DMP tool is working towards is that by having data management and sharing plans a bit more standardized and following their templates, it actually makes them more machine readable. And so this can ultimately help foster interesting collaborations and connections. So if data management and sharing plans are machine readable, you can get a better understanding of what institutions are planning on generating what types of data and where those data are ultimately going to end up in. So all of that leads to more open science, which is a very exciting thing to have happen.
Yeah. All right, our next question, this will be for Katie. In reference to ICPSR and regarding interoperability, could you expand on the standards that you use to make the contents of the CSV documents interoperable? And if so, with what other data?
Yeah, sure. I mean, I could probably use a little bit of clarification on those questions, but I'm not sure if the question is about sort of the encoding of the data inside the CSV file, like UTF-8, that sort of thing. But yeah, we were just generally using a standard CSV format, so I would need to check back into that and get back to you. But essentially, Most of the variables are quite simple, either binary or categorical variables that have a value that is explained in the metadata codebook. So it's either 0 or 1 or something ranging from 1 to 5. Maybe the only complicated field would be the free text responses to the qualitative questions. So hopefully I answered that question.
And I guess for the other presenters, if you have done work and put work into CSV files, were there decisions that you made, or were there components of the research that made that format more accessible or interoperable than other formats that you've worked with?
I'm just gonna say, back when I did research, we weren't even thinking about any of these topics. So if I were to, as now with all the knowledge I have, if I were to go back to myself in grad school, I would definitely be thinking more in terms of setting up my file naming convention to be a bit more machine readable. So that way it's a lot easier for other researchers to get access to which CSV is the one they want, whether it's the README file that describes what I collected and how I collected versus the actual data itself.
All right. So our third question is for Dr. Kilduff. How did you decide on your repository, and why did that make it the best fit for your animal sleep data?
Sorry, I was having a problem with my cursor.
No worries. Yeah, no worries.
So at the time we were searching for the initial, it was a mystery. There were so many different alternatives, and no one had done anything like this. So we were a bit grasping in the dark. But I had been aware of Susan Redline establishing the NSRR. And it occurred to me, of course, since it is already is one of the major funders for sleep research, I should point out, is the National Heart, Lung, Blood Institute, because in terms of sleep disorders, sleep apnea is the 100-pound gorilla
Hmm.
in the field, and it just seemed like a logical extension of the human studies that were there, that this should also be a place to deposit animal-based studies, because a lot of the neuroscience study databases we looked at, not only were they evolving, but things were more amorphous, I would say, in terms of being able to determine how to fit a sleep data set into a particular format that you're not so familiar with. Whereas it seemed like in the NSRR, a lot of those things had already been worked out in advance for the human studies. So it was relatively painless. I have to say the staff who run the NSR makes it very easy for people to upload their data. So it's more the major effort is really organizing it into one place and getting it in
Mhm.
a format so that it can be uploaded. But I got someone on my staff now who's a specialist in this.
Thank you. Our next question, I think we'll start with Dr. Bradford and then open the floor. For a team with limited resources, which fair practice would you recommend prioritizing first?
Rather than focusing on a specific practice or principle, I would choose to give those folks guidance and have them seek out repositories that best fits their needs. If they have limited resources, one of the things that can be a benefit of choosing a repository that's specific to their domain or data that they're generating is that some repositories will offer curation services, and that can be a way for some labs to handle those limited resources in terms of personnel. However, if your limited resource is you're low on budget and you need those curation resources, another thing I would encourage investigators to do is take a look internally within their own institutions. Many institutions through their library have services for curating data as well that has been very interesting to see that resource be actually used. So, but yeah, so by putting your data into a repository, you're actually supporting Findable and accessible. I think the worst thing in the world is, and one quick story, when I was an undergrad, I was working with my PI and I generated data. I was so excited. I came and I show him like, look what I found. And he's like, hold on. And he turns around in his chair and reaches back into a filing cabinet and pulls out this super dusty set of printed pages and says, I can now finally publish this paper with these data. Putting it in a repository is so much better than that.
Wow. Okay. So the next question, we'll start with Dr. Kilduff, and then open it up. We're curious to hear what are unexpected collaborations or insights that came from making your lab's data openly available?
Thank you for asking that question because it's a point that I meant to mention that I had forgotten. So the last slide I showed before the acknowledgements was a study on non-human primates. And everything else we have deposited to this point has been rodent-based data. We've done obviously a limited number of non-human primate studies. But indeed, one of the groups at Brigham and Women's Hospital was quite interested in sleep spindles. I don't know if you're know what sleep spindles are, but they are a certain frequency between roughly 12 and 15 hertz. And they are associated with, there's a link between spindles and schizophrenia that the group at Brigham and Women Hospital wants to explore, or have been exploring for many years in humans. And so they want to extend that now to non-human primates and to rodents to see what the continuum is across the animal kingdom of the link between spindles and other states. So, and as a consequence of that, we have published two other primate studies that were pre-HEAL days and almost, it wasn't pre-NSR days, but now we're trying to retrospectively get data that had been published maybe 7, 8 years ago in a format that we can upload to the NSRR. So there'd be a larger set of data for people who are interested in looking at non-human primates than is available at the moment. As you might imagine, those studies are extremely rare.
Thank you. Does anyone else have other examples before we move to the next question?
Just to say, after certain presentations, folks have asked us, it'd be great to have access to all those policy data in one place, and we can say now, yes, here you go, here it is. So that's been helpful.
Excellent. Thank you. The next question will just open up. What are the challenges in submitting data to a repository for the first time?
Yeah, so like anything else you do for the first time, there's going to be a lot of back and forth. Um, and as I mentioned previously, we were very pleased with the interaction we had with the people at NSRR who really took us by the hand and guided us through. And, the initial survey is basically an Excel spreadsheet. And the first time you're filling out things that ultimately are metadata, it's like, okay, wait a minute, how much detail should I put in? How little detail, and so forth. So it's really good to get feedback from people who are knowledgeable on the other end of what people need. So I think that it's the only data repository I've interacted with, so I don't know if that's typical or an unusual situation, and you're able to get some feedback from knowledgeable people about that.
Katie, had you submitted to NetApp before this project?
No, this was also our first experience, and I alluded to some of those things towards the end of the presentation as well, where we had realized like, oh, if we had harmonized, if we were able to, from the get-go with the survey, harmonize the way that those responses were being recorded, and realize, like, for example, when we were adding or deleting questions, some things were getting shifted in the back end as far as the numbering of the responses. That would just make things simpler towards the end, and the way we were handling non-response in the survey. So taking a look at those guidelines up front can be a time saver.
Mm-hmm. And I will say, before we go to the last question, the HEAL Data Fair website has a whole resource sections on repositories, and we link to both guidance and how to for each repository. So even as you're looking at how to suggest or to identify a repository, you can read general guidance information. So that hopefully that is helpful. And also we as HEAL stewards are here to help out with questions that you have when you're looking at different repositories. So for our last question, we're going to start with Dr. Volofsky. The question is, can we upload data into a repository even if we are not publishing a paper related to that data?
So, is it a question about the repository to a HEAL data or any
I would say,
repository?
yeah, or what is the NIH policy on sharing and uploading data as related to a HEAL funded project?
So the data, the data should be shared with the HEAL data ecosystem and should be shared with one of the HEAL repositories. So, and this is the compliant. This is the requirements of the HEAL program, HEAL initiative. So, based.
So one thing I will note is that by putting your data into a repository, there is now a persistent identifier associated with that data set, which will help maintain attributions to you and your research lab for generating that data, which is an important point that we want to ensure folks remember.
And then Dr. Kilduff?
Yeah, I did want to make one underscore one point that was made in Kira's presentation, and that is starting when you start the project, to plan in advance where the data is going to go and how you're going to organize things. Because this, for those of us, well, this has only become a mandate in the last roughly 5 years or so. So everything we've done has been retrospective. And that is uploading the data at the end of the study after it's been published. And all of us who've been down the pike before know how difficult it is to get a paper published in the first place. You go through umpteen drafts, and then you get the reviewers' comments, and then it's got to go to a second journal and so forth. And when it's finally published or accepted, you never want to look at it again. And then to hear that now I've got to upload the data, it's like, the head smacking experience that so when it's done retrospectively, but if you do it prospectively from the beginning and you think that, okay, this is going to be one of the endpoints, that just changes the entire dynamic of the situation. So just a word to the wise for people going forward.
Thank you. So I would like to thank all of our presenters today. We're going to share a slide. On the next slide, we'll show you a list of all of our resources that we have available. And you are welcome to connect with the HEAL stewards at any time to ask any questions or to set up a consultation about topics around data sharing, data curation, data deposition. And on our next slide, we have a list of acknowledgements. In addition to our presenters and panelists, there are several people who work behind the scenes who work to help bring this webinar to production, and we would like to thank them. Next slide. And finally, we would like to thank you all for joining us today for this webinar. So in addition to the recording for this webinar, we will also email everyone who is registered a list of resources related to this webinar. The slide deck will be shared, and we will also include a link to our Slack channel and a Connect with Us form in case you would like to set up a meeting or a consult. We hope that you will reach out to us for any questions and support that you have on your FAIR journey to maximize the value of your HEAL data. We look forward to having you join us on Thursday, October 16th at 1 p.m. Eastern for our next webinar, which will be focused on data sharing throughout the research lifecycle. Thank you again and have a wonderful day.